Good afternoon. I am Amanda Woods, and I am one of the oncology exercise specialists at Wellness House. And so I thought we could spend some time today talking about, in general, some exercise guidelines. So here we go. And in the interest of time, we'll try to be brief as well. So exercise during treatment is safe and possible. And our goals with exercise during treatment is to make exercise an integral part of daily life, to maintain strength, endurance, and level of function, as well as improve overall quality of life. So exercise can help reduce chemo and radiation-related fatigue, which I know has been spoken about a lot today. I'll dive a little bit deeper into fatigue as we get along here as well. And it can help alleviate severity of pain, decrease nausea, and enhance recovery from procedures. And some exercise barriers. So these probably look familiar to a lot of you. So, some of the top 10 barriers include illness or other health-related problems, joint stiffness, fatigue, pain, lack of motivation, weather, lack of facilities, weakness, lack of interest, and fear of falling. So a little bit into that piece of the cancer-related fatigue. So CRF is one of the most common and persistent distressing symptoms. And I won't read that whole description, but basically it interferes with your activities of daily living, and it's outside of the norm of your usual functioning. So looked at, 16 study review. There was small but significant reduction in that cancer-related fatigue in favor of exercise groups. And then also significant reduction in CRF in aerobic exercise programs specifically. And then also looked at studies conducted in supervised settings that also reported significant reduction in the cancer-related fatigue. So a supervised setting could be something that is similar to what we do at Wellness House, which I'll go into a little bit more as we move along. And then also significant improvements found in exercise programs conducted during or following treatments. And then exercise interventions were beneficial in diverse cancer sites as well as treatment stages. So as you're looking for an exercise plan, so ACSM, if you're not familiar, is the American College of Sports Medicine, and ACS, they have specific guidelines for cancer survivors specifically, and so they look at first aerobic exercise and then strength-based exercise. So their recommendations is going to be 150 minutes of moderate aerobic exercise per week. So what that looks like is about 30 minutes 5 days per week. Now, that doesn't mean if you're, not doing much physical activity now that you should start by 150 minutes of moderate exercise per week. So starting with shorter bouts, maybe 10 minutes, 2 to 3 times per day, so maybe in the morning, afternoon, evening, has been shown to be beneficial, as much so as having 30 minutes altogether. So start slow, start with maybe 2 to 3 days, gradually increasing as you are able to tolerate, and then including 2 days of strength training per week as well as part of their recommendations. Now, it has been shown that less than 30% of cancer survivors are actually meeting these guidelines. So here are some ways that we can help get you motivated and get going. So start slowly, as we talked about there, allowing enough time for the body to adjust to the increased activity level. Choose activities that work the whole body, and the exercise should not cause pain. So you may feel muscle soreness, but it should not cause pain. And then you should be able to talk while exercising. If you can't speak comfortably, then you should reduce your intensity level. So I'm not sure if any of you have seen this chart here. This is a rate of perceived exertion. So this is how you can tell what level is moderate for you, what level is light, and what is kind of that max level. So you want to kind of maintain in your, it's a 1 to 10 scale, so about a 4 to 6 is where you're starting to breathe heavily, but you are still able to hold a conversation. So if you felt like it's almost impossible to keep going, you are completely out of breath or unable to talk, you would probably be at that max effort level, and that is not where you ever want to be. You may get to that point, and then you know it's time to back down. So you want to start in kind of that very light activity for a brief amount of time for a warm-up, and then gradually getting into that 4 to 6 range for the moderate activity, and then kind of coming back down into that light area for your cool down. And then some ways to start to increase overall activity level. So some people find it helpful to keep a fitness journal. So writing things down, how long did you maybe go for a walk today? How did you feel? Did you feel better after that? So kind of tying some of the emotional piece to the exercise can help you really start to learn what is going to be the best benefit for you. Pedometers, some people find, at least alerting themselves to how much they're moving throughout the day. So making maybe a short-term goal related to steps per day, a long-term goal, but basically just becoming more aware of how much you are actually moving. Using stairs rather than the elevator or escalator if that is a possibility for you, if you can safely navigate stairs. And then, if possible, starting to park a little bit further away from your destination. Again, if you are ambulatory and don't have any physical struggles with walking longer periods of time. Exercise with family, friends, or coworkers. So having that support can help mentally and physically to have people there with you. Take breaks from long periods of time sitting. So maybe every hour or so, just getting up and walking around a little bit, stretch, just to kind of get the blood flowing again. And you can also, if you are sedentary, you can do exercises while you are seated. So maybe if you're watching TV, there are still things that you can do, seated that can help benefit and increase your activity level as well. Some of you may be familiar with yoga, so I did want to just briefly go through some of the benefits of yoga because it does have potential to have benefits both mentally and physically. So yoga involves physical postures that help develop strength and flexibility while promoting relaxation. So yoga is a meditative practice that helps to focus on breath through each pose. And then there's also a growing body of research that has helped show the beneficial effects that can help with improvements of fatigue, mood, and overall quality of life. And yoga, if you are familiar or not familiar, it can be done, in a chair as well. So if you do have some limited mobility, if you think, I can't get to the floor, I wouldn't be able to participate in yoga, there are different levels of yoga, so it could be a possibility as well. So some exercise precautions. You always want to make sure that there's a day of rest in between strength training exercise days. It's okay to do aerobic exercise on consecutive days. So like walking, it's okay to do that every day. If you're experiencing pain, like we talked about earlier, it should not be painful. And or excessive shortness of breath, make sure to stop and alert your physician. Delay exercise if you are anemic until the anemia improves. Avoid exercise in public places if immune function is compromised. If fatigued, flushing or GI upset, or any other additional side effects, it can be helpful again to start with those shorter bouts to see how the body will react to exercise. And then avoiding chlorine to any skin that might be irritated during radiation. And then also avoiding water exposure, so staying away from the pool for a little while, or any specific resistance training if you have indwelling catheters. And then just briefly wanted to talk a little bit about Wellness House. I know some of the participants up here had briefly mentioned it before during the panel about Wellness House, so I did want to just show you a little bit about who we are and that we are there to help a community where we envision people who are affected by cancer thrive. All of the programs are offered at no cost. We have 40 plus exercise programs, chair, standing, mat, and we're there to help guide you to what would be the best fit for you if that's something that you were interested in, not sure where to get started or how to get started. We offer yoga classes. We also offer Tai Chi and Qigong. Again, if you're unfamiliar with those, it's more of that meditative meditation through exercise. So it does combine that relaxation piece with the movement piece. We have open gym that you're able to utilize all equipment at your own discretion. And then as we talked about, having those structured exercise classes to really help guide you through each exercise to show you exactly how to do that. We do that through individual consultations, fitness assessments, and then all of those committed exercise classes do require physician release, so they know that you are interested in starting an exercise program and making sure that it is a good fit for you.
Good afternoon, everyone. So I get to be part of the wrap-up. Super excited about that. What a wonderful day of connecting and information gathering that we have been able to get. I just want to say that there's a whole lot of other things that everyone in here could have been doing on this beautiful Saturday. So to choose to be here today, I think that speaks to self-care for yourself. So I just want to give you all a round of applause for that. My name is Maigenete Mengesha. I am a staff member at Wellness House along with Amanda, and just want to thank Lauren for inviting us to be a part of this presentation. I think that really speaks to the holistic model that we preach and have found to be most effective at Wellness House, right? So we allow the great doctors, and boy, we've gotten to hear from the legends in the field today, to do their good work, but we really firmly believe that there is a whole lot of other healing that takes place through the cancer experience. And so we want to talk about some of that. Amanda already spoke about the exercise piece, and so my area of the house is more of the psychosocial needs. So my training is as a psychologist. So briefly, I'm going to talk about the 3 helpful tips to best support mental health for those impacted by carcinoid and other NETs. So first of all, getting connected, right? You all are already doing that. So we say at Wellness House, no one should go through cancer alone. And, at Wellness House, we have a wonderful group that meets. That's like this whole area. So for those that are a part of the carcinoid group, can you just raise your hands? So my charge to all of you here that don't have your hand raised is to connect with one of these folks, because they can speak to the richness of the discussions and the connections that take place. I have personally witnessed people come newly diagnosed, and they come to the group, and first of all, that they're amazed that there's so many people in the room. But secondly, two hours later, they leave with just a wealth of knowledge, which, right, knowledge is power, and so that's important. But then also phone numbers and a community, and which I think that's a pretty a crucial piece to go through the cancer, and especially with a diagnosis of NETs. So please do that. We've talked, I think, enough about Wellness House. I have the website there. I think you guys are all going to get these slides, so you'll know how to reach us either by email. If I haven't given you my card, I'd love to, so see me. I put the details of when we meet because I feel like is the highlight of my presentation. Carcinoid Group meets the second Saturday of each month. And everything is on the table. We can talk about anything from diarrhea to everything in between. And it's all welcomed. And I say that intentionally because I want people to be able to feel comfortable to come and to ask whatever questions that they have. And we've gotten to hear from experts like Dr. Koiken has come, and we just really appreciate that. Because we have such advocates in our group, they have recently created a website, Chicagoland Neuroendocrine Carcinoid Support Group, and they're so resourceful. They've got handouts here, and so for those that have the handouts, we've got them at the back table as well, but please connect with our group members. They are outstanding. So what else am I suggesting to do? To seek professional support. So I just want to pause and get serious for a second and say that receiving a cancer diagnosis of any type, we call it traumatic. And so, and we say that intentionally because we want people to recognize that because it's a traumatic experience, whether it's the diagnosis itself or enduring the subsequent treatment, that you respond appropriately. So what I mean by that is to seek support. So many people are supported in their community, in their family, in their church or neighborhood, and that's wonderful. That's, the more support, the merrier. But it's a different level of support for those that get it, right? So for those that have walked a few steps, ahead of you, that they'll know uniquely how to support you. And so with that, whether it's group support or individual support, plug to Wellness House, we do it all, but it's really important to seek professional support. The rates of depression and anxiety are much higher among those that have a cancer diagnosis, and so we really take that seriously and want to say seek support, just want to normalize it as much as I possibly can. Many only focus on the physical aspects of cancer. And so as they're feeling better physically, right, they may then at that point begin to have more of the emotional pain, have room for it. And so we really want to encourage people to seek support. Third thing, hear me out for this one. So know when enough is enough. So I think that I refer to this as the Pandora's box phenomenon. Maybe some of you have experienced this. So what happens, I think, uniquely with NETs is that if you get a diagnosis, and oftentimes because it's widely misunderstood and commonly misdiagnosed, and maybe for years, right? And so that's part of the initial experience. Once you do have the diagnosis, you then take it upon yourself, right, to kind of fill in the gap, right, along with the great care that you're getting. But what often happens from an emotional standpoint then is you feel as if you have to become an expert. And so that begins the Pandora's box. You want to research as much as you can, and what happens, and it's difficult to shut that off. Right, and so there goes the challenge of, as I think it was Mary mentioned in the panel, is forgetting to live your life, right? So I don't want to say don't be an advocate at all, but I do want to say that I think it's important to find that balance of doing enough research, getting connected with some of the legends that you've gotten to hear from today, and then living life, right? So that you don't land in this Pandora's box phenomena, which I think is just a part of the natural progression of what happens. So just to learn to balance being your own advocate and still be you. I've seen it done. And I think doing it in a group is another way to do it and kind of expedite that process to get, among a community of people who can kind of help you out and keep you accountable. So lastly, I don't think I'm going to take any questions out, but I do have email and phone numbers and ways to get in touch with Wellness House. On behalf of Amanda and I, we thank you for this time and have a wonderful day.